You're watching the Fox 5 Morning News.
April is National Cancer Control Month. Joining us this morning is Dr. Richard Chaffoo. He's with Scripps. He joins us with the A, B, C, D, and E's of melanoma. Good morning.
Good morning, Erica.
All right, so let's first of all talk about what we're seeing with melanoma. Are we seeing more cases of it?
You know, Erica, we are. We're seeing overall a significant increase in all kinds of skin cancers. The American Cancer Society has told us that skin cancers are the most common type of cancers, and certainly melanoma is the killer. So we want to be able to look for those lesions that look unusual or strange to get in to see your physician about.
Okay, let's go through the A, B, C, D, and E's.
Sure. So it's an easy mnemonic to remember. So if you look at a lesion or a mole, if it's something that's symmetrical, has a good, nice border, if it's something that is asymmetrical, it means that one half of that mole is different than the other half. Then C is the color. It should be the same color all the way through the mole. If there are different shades of the color, then that could be worrisome. Then D is a diameter. So basically, if you could take a mole and cover it by a pencil eraser, means it's less than 6 millimeters, it's more likely to be benign than malignant. And the final, the E, is something evolving or changing or morphing. So a mole that's kind of looked the same for a long time, and now it's suddenly starting to look different. Maybe it's a difference in color, difference in topography, it's beginning to ulcer or bleed, it's changing, evolving. That's a sign it could be a cancer.
That change is significant. You brought a model here with you.
I did, yes.
To kind of figure out how to self-examine, right?
Exactly. So the most important thing is for someone, if they're going to do a self-examination, they want to be, you know, obviously shirtless, or something very short and looking at. There's certain areas that we can't see, Erica, but obviously the areas that you can see, the areas of sun-exposed areas are the areas that are the most concerning. So the areas on the face, the ears, the nose, the lips, the back of the neck, the shoulders, the arms, those are all areas of chronic sun exposure and the areas where you can have a look and see. But the important thing about seeing a physician is they'll examine the areas that you can't see. So the dermatologist will look at areas, for example, in your scalp, in your hair, behind the ear, another common location. Areas on your back that you can't see yourself directly or even with a mirror, and other areas on the trunk and extremities to look for something that's got any of those A, B, C, D, E features, or a new spot or a new mole, something worrisome.
Let's talk about the best ways to protect yourself from getting it in the first place.
Yes, so the sun precautions are the big issue. So obviously if you're going to be outside, any kind of sun exposure, you do want to use a sunscreen. You want a sunscreen, the American Academy of Dermatology recommends at least an SPF of 30.
Okay.
It's got both UVA and UVB protection. You want to apply that at least 30 minutes before you go outside, and you want to reapply it every 2 hours or more if you're sweating or doing any exertional activity, because we know there's not really any such thing as a waterproof sunscreen. So as we sweat, we're going to sweat that off. And then we want to make sure if we're outside, the peak time for sun exposure, Erica, is from about 11 a.m. to about 4 p.m. So if you're going to be outside during that time period, you want to limit your sun exposure. You want to wear a hat with a brim. You want to wear sunglasses, which are essentially the sunscreen for the eyes, because we know melanoma can occur on the retina or the back of the eye. And you want to wear sunglasses that have both the UVA and UVB protection.
Very good. Dr. Chaffoo, thank you.
Thank
Male
you.
model, thank you. We appreciate it. If you'd like to contact Dr. Chaffoo, we'll put the information on our website, fox5sandiego.com. Just click on that Scene On tab. All right, back over to you.